difference between an outbreak, epidemic, and pandemic? In these unstable times, we can't escape the news about COVID-19 known as coronavirus. It's something that takes over our news feeds, and TV holidays have been canceled, most of the states are on lockdown, and countries all around Europe are enacting their plans to fight this viral threat. The World Health Organization announced in early March 2020 that the virus was now at a pandemic stage around the globe. But, what exactly does that mean? How is a pandemic different from an outbreak of an epidemic? Surprisingly, the definition of each word isn't exactly a scientific term that's tied to cold, hard, measurable data. Rather, they're words with both scientific and political meanings that link to a whole bunch of different factors. How can we measure these specific terms? The definitions for each of these terms are measured against a series of different factors, such as the disease occurrence, incidence, and the known or unknown pathways of transmission the disease uses. These three specific terms are usually used to classify the spread of a new disease, labeling it as an outbreak, epidemic, or pandemic. What is pandemic? A pandemic is defined as being present globally and spreading out of control. So, when the World Health Organization declared the spread of COVID-19 to be at the stage of pandemic, it shouldn't have come as a surprise given that the virus had spread to 125 countries and territories in total. However, the declaration of a pandemic doesn't mean the end of the world is near, it simply means that the spread of the virus has reached a global amount. What is an outbreak? The term outbreak can be summarized as a small, but unusual burst of disease. An outbreak is usually what is used to refer to a geographically contained spread of disease. The primary coronavirus cases that were contained in China would have 19, when cases in China started to rise exponentially and we started seeing cases of the COVID-19 strain rising across the world. This shifted it from an outbreak to an epidemic. Let's conclude all these statements. We must remember that these terms are as essentially scientific as they are political, and that the use of the term pandemic by the World Health Organization signals that COVID-19 is a global threat, and that all governments should continue taking the suitable prevention and argumentative action they are currently taking. At last, just remember to stay calm, follow the guidelines for cutting down the risks of infection, and call your country's health service for advice if you think you may have contracted it.